Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us over the line from Saskatoon is Scott Livingstone, SHA CEO. Premier Moe and Dr. Shahab will both have opening statements, then we'll have time for questions. Premier?
Well, thank you very much, and good afternoon, everyone, and thank you for joining us here today. Sadly, today we are reporting 2 more deaths related to COVID-19, and our most sincere condolences to the family and the friends of both these individuals is extended. Today is a big day for the reopening in the province of Saskatchewan. We're down to 17 active cases in Saskatchewan, and we are moving ahead with Phase 3 of the Reopen Saskatchewan plan. This means that today restaurants are open for business, gyms are open for business, childcare facilities will be able to expand their numbers, and remaining personal services will now be open. As of today, virtually every type of business in the province can be open if they choose to do so. Really, the only remaining exceptions are casinos, bingo halls, and theaters, which will be part of Phase 4. Today, the vast majority of businesses can open, and it is our hope that the economic activity will increase, and many that have been unable to work over the last number of weeks will now have an opportunity to do so. Places of worship can also reopen for indoor services of up to 30 people as part of Phase 3. And we continue to work with the leaders from all faith communities to find ways to safely increase the attendance at religious services and celebrations such as weddings and memorial services. This is a priority for us, and I would like to thank each of the leaders of all faiths that have been offering not only their advice but have been offering their experience to public health throughout this journey. It is appreciated, and I say thank you. During the past few months, educators across the province have been making every effort to safely offer the opportunity for our students to finish their studies through distance-based learning. Recently, we've been asked a number of questions on the potential for grade 12 graduation ceremonies this spring. I'd like to make a few comments to clarify the province's position on graduation ceremonies. It's always been our view that graduation ceremonies can and they should occur, albeit in very innovative ways. We would ask that these events, which could include in-person ceremonies, respect all of the public health recommendations and orders that are in place. And I've heard of numerous very innovative suggestions ranging from parades to smaller gatherings, allowing graduates and their families to celebrate their important achievement. And I would encourage graduates, parents, and those interested in organizing their ceremony to work directly with their school or their school division to make these events possible. Grade 12 graduation is a very special recognition of the many years of hard work and commitment that you have provided. And I would like to take a moment today to offer my congratulations to each and every one of this year's graduating class on their monumental achievement. We're also working hard to ensure that additional recreational activities and more medical services have the opportunity to restart. Today, I'm pleased to announce that as of Friday, June the 12th, this Friday, that beaches and playgrounds will be able to reopen. Hopefully it's a great weekend so that families can enjoy some time at the beach or some time at the playground. In the far north, we are down to just 6 active cases. So the remaining restrictions on travel in the northwestern part of our province are being lifted effective today. We also now have reopening dates for most of the 12 emergency rooms that were temporarily closed. 8 of the 12 ERs will reopen in June. Robert on June the 12th, Arcola and Leader on June the 16th, Priestville on June the 18th, Biggar and Oxbow on June the 22nd, Davidson on June the 24th, and Herbert on June the 25th. And we are working very diligently to ensure that the remaining ERs open as quickly as possible. Those other 4 ERs have some additional ongoing staffing issues that are unrelated to COVID, and so the Saskatchewan Health Authority is working to ensure those are resolved and those ERs are opened as quickly as possible. You can also expect to hear more about the resumption of elective surgeries and about the fall school year later this week. I want to take a moment to remind everyone that even though Saskatchewan people have done a great job, and they have, at controlling the spread of COVID-19. I want to say thank you for that. This virus has not disappeared. COVID cases still continue to increase in many parts of the world, including some other parts of our nation and many areas of the United States. So we need to remain vigilant. But in Saskatchewan, we have proven that we can control the spread of this virus. We can reopen, and we can control the spread in the future. Today, virtually all businesses in Saskatchewan can be open and they can operate, and they are doing so as safely as possible. They're doing this so that many of us can get back to work, so that more of us can worship in accordance with our faith, and so that more of us are able to access the medical health services that we require, and so that more of us as families can enjoy our communities and the great Saskatchewan summer. I'll now turn it over to Dr. Shahab for a few comments.
Thank you, Premier. So first of all, I'll begin by expressing our condolences to the friends and family and community of the two individuals who passed away as a result of COVID-19. Both were residents of the far north, and both were seniors in the 60s and 70s. So again, this is a reminder that elders remain the most vulnerable, and whenever we have large clusters or outbreaks, even though 80% of the cases are mild, 20% can require a higher level of care or hospitalization, and unfortunately, in a few cases, we can have death as an outcome, as a very tragic outcome. The other thing is, I just want to take a little time about saying that as we have larger and larger gatherings, 15 indoors, 30 outdoors, there's obviously a lot of interest in having even bigger gatherings, and we're receiving a lot of requests, and we are looking at that closely. But I do want to walk through a few slides quickly and then go over some basic principles as we look at going about our business as part of reopening Saskatchewan, but also this ongoing discussion about gatherings. So in terms of slides, I'm just going to show some slides that have been shown in the past, but just to revisit a brief history of COVID. So, sorry, I'm just getting the hang of this. So as you can see, we are now in a very safe place in terms of the effective reproductive number. Overall, in Saskatchewan, we are well below 1 at 0.64, and that is for the north at 0.76, as well as the south at 0.63. So these were hard-won gains, and it's important that we retain them. And for the north, especially the recent cluster, they have just now emerged from travel restrictions. And I think we need to keep that in mind. And we also have to remember, if you look at this slide, that you can see that in the first week of April, Saskatchewan had an effective reproductive number of 2, and the north around 3.3. So we were effectively in an exponential growth. And then Saskatchewan came below 1 towards the end of April. The north had a significant cluster in the middle of April towards the early part of May, and also now has gone below 1. The red line is below 1. So we have to remember this is recent history. This is the last 8 weeks. And so while we're very keen to move ahead and should move ahead safely, we have to remember that what we've gone through is in the recent past. This also shows, and again, in March, middle of March, most of our cases were travel-related. And by the way, we've had, the 4 cases that we've had, 1 is in the far north linked to an ongoing case, and 3 still are travel-related. We have ongoing travel. Individuals are quarantined for 2 weeks, and there's little risk of further transmission apart from household contacts. But we have to remember that when we had, for the vast majority, travel-related cases and some transmission due to large gatherings, if you look at the left side of the curve, you can see that we were doubling our cases every 2 to 3 days. In Saskatchewan, mostly initially in Regina and Saskatoon, in March and April, our case numbers are doubling every 2 to 3 days, and we were in a very concerning trajectory. This is recent history. And then, of course, over end of April, May, our case doubling has gone down to 29 days and now 35 days. So these have been hard-won gains done through a lot of sacrifice and different way of leading our lives by all of us. this really shows the white boxes are all the orders that are put in place, all the restrictions. And so this was the hammer of lockdown. So in the early part of March and April, more and more restrictions on school closures, smaller size of gatherings, all kinds of businesses were closed. So in some ways, this was really hard for the economy, really hard for individuals, but in some ways, a difficult decision for government, I'm sure, but an easy decision because everything closed down. And on the right, you can see towards the middle, you can see that we had then specific restrictions for the north and northwest, which really, again, were due to the cluster in the north. And we have to remember that this is not a place we want to go to. But, if that is the only option, then that will have to be the only option. But we want to avoid as much as possible putting in broad restrictions and be more thoughtful about what are the settings in which transmission is happening. Avoid large-scale transmission as much as we can, but if it happens, be more thoughtful and surgical in terms of what do we want to slow down versus allowing the vast majority of the economy and our day-to-day business to continue. And on the right, again, you can see the green boxes that are the phases, ROSC 1, 2, and 3. So we want the green boxes now to be predominant, and we want our curve to remain flat. The green bars, and this is on the net, on the website as well, are the daily case numbers. A couple of spikes, one province-wide, and then one later on in April, May in the north, and our cumulative case numbers. This is just a schematic showing the obsession we have with gathering size. A lot of modeling, a lot of mathematical modeling has shown two things. If your gathering number is small and it's local, it's like kindling that if it catches fire, it burns out because it's small. And 20 to 30 seems to be the sweet spot. That's why we went below 20, went to 15 indoors, and we've gone to 30 very cautiously outdoors, although that starts pushing the envelope for more rapid transmission, but that's where we are. And repeated models and actual experience shows the larger the gathering size, the more exponential the transmission. And we saw that in the early part of March, we had transmission throughout Canada from large conferences, from large other community events. So I think we can't forget that recent history and quickly and without a lot of thought go to large gatherings. Even if we go to gatherings more than 15 indoors and 30 outdoors, we really need to think through how can we do that in a different way? How can we maybe continue to have indoor cohorts of 15, maybe in separate rooms or otherwise with some clear separation throughout an event that prevents further transmission. And I think that is essential, and we need to put some thought in that. And finally, we've shown modeling slides of our own, but this is just a slide I picked up from the BC Ministry of Health website, but I've asked for some modeling updates for us as well. And this really shows that, business as usual is everyone is, going about their routine lives, 100% social mixing. We went down to maybe 40, 50% of social mixing. That's the first box on the left, and really flattened the curve. And we did that while a vast majority of our economy was working. People were working in essential services, in healthcare, in utilities, trucking, grocery stores. We were able to maintain about 40 to 50% social mixing, others staying at home, working from home, otherwise staying home, in some cases, unfortunately, not employed. And that's how the curve was flattened. And even when we went out, maintaining physical distancing. If we go up to now reopening the economy, but maintain a social mixing at 60%, small gatherings, trying to meet the same 4 or 5 households, not different people every day, keep a social mixing at 70%, that's the second box on the top, we can prevent a surge. But once you start getting into that 70 to 80% range, you start hitting an area where you are at risk of the second wave. And this is not really meant to alarm or scare. This is just meant for all of us to understand that as we go about, enjoying the outdoors, engaging in business activities or recreational activities as part of reopening Saskatchewan 3, outdoor sporting events as part of 4.1, lots of other cultural entertainment activities as part of 4.2. We need to keep in mind that we need to do that in a safe way, following guidelines, observing physical distancing, and avoid that hitting that 70 to 80% of social mixing, where we would again be in a second wave. And I think And that really has to be paramount as we go forward over the summer. So with that, I'll just maybe reinforce a few points. So small, infrequent gatherings are better than large, frequent gatherings. Outdoor gatherings, while observing physical distancing, are better than indoor gatherings. Meeting more or less of the same group is better than meeting a lot of new people. And social interactions locally are better than social interactions across large geographies. Of course, there may be that special event that's a small gathering of under 30. That may be a special occasion where people may come from other parts of the province, but those should be infrequent and not frequent. And then finally, I just wanted to highlight that while there's been a lot of concern, obviously, in terms of recent protests where there were a large number of people. I think we just need to remember that as we go forward, as there are gatherings, either as part of a protest or to observe a solemn occasion or other ceremonies or cultural events, I think it is important to put some thought to the fact that we do need to prevent sudden increase in case transmission, and allow reopening to happen in a way that's safe, in a way that's manageable. And then, of course, in the fall, there'll be other major events that will have to be considered. But I think if we can allow phase 3 to succeed over the next 2 or 3 weeks, allow phase 4 to succeed, and then reevaluate what is possible in phase 5. I know there were concerns that when I said that the pandemic will continue as far as June. But within phase 5, really the question would be about gathering sizes. How do we gather in a safe way, minimizing risk of uncontrolled transmission? So I just wanted to lay this out for all of us to think about as we engage in phase 3 and phase 4, and think about the future, about phase 5 as well. Thank you.
Thank you, Doctor. We'll now take our first question from the phone line, operator.
We have Adam Hunter with CBC.
Good afternoon. I'm wondering what the guidelines are for playgrounds and beaches. And for example, will this mean that school playgrounds for the school divisions and city-owned playgrounds will be open on Friday?
Go ahead, Doctor.
So the guidelines are being developed. My understanding is they will be released shortly and likely in time for this weekend. But we will have that information. And I agree. I have observed, for example, a week or two ago, I observed, some older children using school playgrounds. This weekend, actually, I saw a bit of a toddler playground rebellion, where I saw some parents actually cutting away the tapes in and around the city and putting their toddlers onto swings. I think there's a lot of frustration, and in BC, for example, some playgrounds are open. So I can understand the need for parents to get their children out and in playgrounds. We also understand there needs to be some guidance around hand sanitization and so forth. They're probably low risk right now with the low case numbers. So, the ability to use playgrounds should be here at the end of this week by Friday. Municipalities obviously need to be kept in the loop in terms of to allow for any grooming or any preparations that need to happen for those playgrounds. So please comply with municipal signage as well. Similarly, for beaches and parks, some precautions around using washrooms, and obviously municipalities and RMs need to make sure that there's enhanced cleaning and of those facilities. But certainly, as long as you practice physical distancing, for example, on a beach, as long as you're physically distant, your household group is physically distant from another household group. It doesn't have to be 2 meters. It can be 4 meters, 5 meters. As long as you give each other space, both on the sand, on the grassy areas, and in the water, it's reasonable to, that we can enjoy our beaches and parks and playgrounds fairly safely.
Follow up, Adam?
We're hearing from this is for the Premier, we're hearing from the mayors of Regina and Saskatoon today and the two cities' police chiefs on defunding city police services. I'm wondering if you believe Saskatchewan should consider this, why or why not?
Well, we haven't been considering this, although we are listening carefully to the concerns that are coming from individuals that not only attended a few of the more recent rallies that we've seen in both of these cities. So we're, it hasn't been under active consideration to my knowledge, but there is a very important conversation I think as we move forward through the next number of days, and it's been an ongoing conversation. If you look back in time throughout this province's history, the nation's history, and even beyond Canada's history, the conversation around racism, the conversation around how we are working with all members of our society so that they are and feel that they are being treated with the respect that they deserve. Again, I go back to this, from the society perspective. We, in the same way that we're talking about personal responsibility with our actions and how it impacts the spread of the COVID-19 virus, we have a personal responsibility in how we treat each and every person we come in contact with each and every day, regardless of where they're from, regardless of their religion, regardless of who they are. We should be treating them in the same manner that we expect to be treated in return. So, to my knowledge, that discussion is not occurring as of yet. It is news to me that the municipal police forces and the mayors are having that discussion, but we're open to to any discussion with our partners.
We'll take our next question for the room. Steph?
Yeah, Mr. Premier, are you concerned that the hundreds of people who gathered not only in Regina and Saskatoon in these protests, and I can understand they're for a specific reason, anti-racism, but are you concerned that that amount of people gathering so frequently is sending the wrong message to the rest of the province that things aren't as bad, we don't need to follow the rules as closely, why should people worry about how many people come over when 700 people gather in front of the legislature?
Yeah, I think my concerns would be twofold. First and foremost, my concern is with the conversation that these individuals are bringing to the forefront. It's an important conversation. It's a sensitive conversation. I recognize that. I think our law enforcement organizations recognize that, as well as other levels of leadership. So it is an important conversation for us to have, first and foremost, on treating one another with the respect that we expect to be treated with in return. But from a spread of COVID-19 virus, I also have concerns, great concerns. As I said earlier, the virus really does not distinguish as to the cause of the large gathering, whether it is a curling bonspiel, whether it is a dentist gathering, or whether it's a rally such as those that have occurred over the course of the last week. And I would hope that we don't have outbreaks specific to these particular rallies. And if we don't, I think that speaks to the success that we have had with our numbers in this province. And that success is not an accident. Our numbers are low in this province because of the decisions that individuals have made. And there are people that have made great personal sacrifices over the course of the last 3 months in not attending memorial services, not attending worship services, not attending graduations, not attending other family events, not attending visits with their family members in long-term care centers. The sacrifices have been great, and we're thankful for them, because the reason our numbers are so low today is because of those sacrifices that each and every, vast majority of people in this province have made. So I am concerned on two fronts. One, on the conversation that is being raised, but two, on how there is a risk with any large gathering of spreading the virus.
Follow-up, Steph?
Yeah, your government in the last few years has actually expanded policing in terms of the PRT in rural parts. So your government has expanded policing. Why have you not kept up with the oversight piece of that? Because for years, the Public Complaints Commission has had to deal with under-resourcing, and there still is no timeline as to when there's going to be a separate kind of agency to investigate serious incidents.
I would... I can't speak as to why the civilian oversight is not what some people think it should be, but I would say that we are in the process of enhancing that civilian oversight, and there'll be more, I think, discussion on this in the week or so ahead. Just after, in the next couple of weeks, I would say there's going to be some more discussion on the first steps that we are taking in enhancing some of the civilian oversight that we have. We do have a police complaints commission, and we are looking at what opportunities, and we've discussed this publicly, what opportunities we have to enhance that civilian oversight over some of our investigative procedures, and ultimately taking some additional steps to ensure that is the case. There is a place for civilian oversight over our police departments, and I think that's one of the I suspect that's one of the conversations that the two mayors are raising publicly today. I have not seen that article as of yet, or that communication as of yet. I expect that might be part of what they are raising, and it's work that's actively underway within the government.
We'll take our next question from the phone line.
We have Zach Vicera with the Star Phoenix.
Good afternoon. In regards to the 2 deaths that were reported today, I noted that yesterday and today we're only reporting 1 person in hospital. I'm wondering what details you can offer about the circumstances of these 2 deaths, whether they happened in a health facility or in a person's home, for example.
I have asked for that information. We did want to report because they were reported to us through our public health information system this morning. So we did add them to our total death count, but we will be updating our information as before in terms of the circumstances of death as an aggregate. Obviously, we don't speak to individual cases, but at a future opportunity this week, I'll provide a fuller update on both hospitalizations, cumulative and current, and deaths by age group and other risk factors.
Follow up, Zach?
I do have one, yes. One other public health trend that's been reported in recent months has been an increase in reported overdoses in both Regina and Saskatoon, which is consistent with reports from many other large urban centers across the country. For everyone on the line, I'm wondering if you've heard of that, what concerns you have, and what is being done to address that.
Thanks.
So go ahead, Doctor.
No, thanks. So there's kind of 3 aspects to that. One is, of course, that mental health issues can be compounded by situations where there's pressures on employment, restrictions on travel, other factors. So certainly with that recognition, the Ministry of Health has been working very closely with the Saskatchewan Health Authority to improve access to services, both for mental health and substance use disorders, as well as to support persons with substance use disorders in terms of enhanced access to harm reduction programs as and when required. Having said that, we have always been concerned with the contamination of the illicit drug supply with substances that can prove fatal, such as fentanyl. And we have seen, and so have police services, seen that risks continue throughout Western Canada and in Saskatchewan, and in fact increase over the recent weeks to months, which may or may not be related to COVID, but is the other big public health threat that we have been tracking now for more than 2 years, which is the opioid epidemic and the contamination of an illicit drug supply with fatal amounts of synthetic opioids. So that has not gone away, and in some cases, in fact, that has continued to progress in Saskatchewan.
I would just say, Scott, Livingstone may have something to add with respect to our mental health and addictions offerings here in the province and where we are and where we are going. But Dr. Shahab has talked to some of the challenges with respect to contaminants in drugs, illicit drug supply, which is already illegal here in this province, and some of the actions that we've taken around naloxone kits, worked with our law enforcement as well as our frontline responders to ensure that, one, they're being kept safe, but also able to save lives when we can. But I think the mental health conversation has been an important one for this government, and we have put funding behind that conversation over the course of the last few years and will continue to in the future. But the mental health and all too often subsequent addictions conversation is one that is increased as well during this time of our response to this global pandemic. And I think, again, it speaks to the personal sacrifice that individuals and families are making over the course of the last 3 months in ensuring that they are physical distancing, not visiting with the number of people that they normally would. And it's a very challenging time for us, not only economically, not only from a healthcare perspective, but from a mental health care perspective and a personal mental health perspective. And so, Scott, if you would have anything to add there, feel free.
Sure. Thanks, Mayor. So the only thing I would add, Zach, is when we did make the move in March to closed down healthcare services in many ways from an elective perspective. There were many services across the province that were impacted, including mental health and addiction services, particularly group counseling going to more virtual. But as we reopen the system, and especially focusing on those everyday healthcare services in phase 1 and 2, mental health and addiction services are reopening across the province. Our focus on harm reduction is as strong as ever, including investments made this year by the government of Saskatchewan to improve that both in Crystal Meth Addiction Center in Estevan and New Ram Clinic in North Battleford. And we are actively moving forward on all our existing services and expanding as we go forward with the resumption of services. Certainly, though, although I don't have the numbers, and you may, it wouldn't surprise me that we would see an uptick. But it's the opportunity now that we're getting back into our new normal to start addressing those things aggressively again.
Thank you, Scott.
We will take our next question from the phone line.
We have Mark Smith with CTV.
2 flights coming to Saskatoon have been connected to confirmed cases of COVID-19. Are those linked at all to the 3 new cases that were announced in Saskatoon today?
I'm sorry, what is the question?
2 flights coming into Saskatoon had 2 cases.
So I'll just reconfirm. Of the 4 cases reported, 3 were linked either directly or indirectly to international travel. So either someone who had traveled internationally or a close household contact. So individuals are still arriving from international destinations for various reasons, either returning expats or other situations. And that is to be expected. And we haven't had importation internationally for some time, but nationally that continues to be a low number of new cases. But they were not linked to any existing clusters in Saskatoon. And then 1 of the 4 cases was from the far north, again, a contact to a close case. So again, there's 2 things. One is obviously we have 4 cases today, and all of them are explained for and accounted for, and they do not pose, as far as we know, any threat of ongoing transmission. But again, I think it's clear that we will continue to see cases through occasional importation internationally from other provinces, and obviously within Saskatchewan as well. That continues to be the pattern.
I would just add to that that we will have some mixing outside of our borders. There has been individuals that have been crossing not only our provincial borders but our international borders throughout our response to this pandemic and providing our communities with the essential services that we need. This has been occurring all along to a minimum degree and only for essential services for sure. There's a number of repatriation flights that have occurred, bringing Canadians home from other areas of the world. Those have been occurring throughout our approach to this pandemic. The federal government has been working hard at repatriating Canadians back to Canada. There are also a number of reunification flights that are occurring and bringing spouses of people. There may be Canadians that are married to someone from another nation, the USA or somewhere else, and allowing spouses to come together after being apart for a number of months. So there has been some border travel, some crossing of our international and provincial borders as we have been finding our way through our response to the COVID-19 pandemic. As we open up our economy, it only stands to reason that there will be additional travel between our provinces and increasingly some additional international travel. Yes, everyone will be doing, to a large degree, virtual meetings and virtual interaction, but there will be some international that will be required, additional international travel as we look ahead through the next number of weeks and months. And so there is going to be some mixing, and with that comes some risk of some cases that will come to Saskatchewan and Canada from other areas of the world. This is one of the things that is considered as we start to reopen the economy here in Saskatchewan.
Follow up, Mark?
Yes. Regina MP Warren Stanley has proposed a physically distanced graduation ceremony at Mosaic Stadium. What are your thoughts on that proposal?
I haven't seen the proposal, but I have read about it in the news, I think later this morning, that it has been proposed. I don't know that particular proposal is being worked on by the Ministry of Education or if it's even been proposed to public health. You might have more to comment on, Dr. Shahab, with respect to that. I know there are a number of proposals and a number of initiatives, innovative initiatives, I might add, that have been being worked on by individual schools as well as school divisions. And so in my opening comments, I had made I'd said some words around if parents and graduates are looking to hold a graduation, whether it be virtual or in person, they should work with their schools and their school division on what they can do that would operate within the public health recommendations and the public health orders that we have. We've always indicated that there is an opportunity for graduations to occur and occur safely, but there are a number of public health recommendations that we would hope the school divisions and the individual schools would be able to follow. I don't know if you've looked at that specific proposal. I have not seen it.
I have not seen that specific, but we have received requests for our local public health staff have received requests for innovative graduation ceremonies, and I think we are looking at some of those models in a way that some may allow for a safe graduation ceremony as long as the basic principles of physical distancing, people not handing back things, and trying to keep, even in an outdoor setting, individual gatherings limited to 30, whether they are staged or otherwise, is important for the time being. And as I mentioned earlier and in the slides, that going forwards, I think we need to think about, especially as part of Phase 5, that what have we learned that allows us to hold larger indoor or outdoor gatherings in a way that we reduce the risk of further transmission. We already know from large shopping stores that a large number of people can safely shop, and it's obvious that it's a large building with high ceilings, good ventilation, and as long as people keep 2 meter plus distance, transmission does not occur. We also know, not so much from Saskatchewan, but from other parts of the world, that when there's singing or other events in a closed group, you can not only have transmission as high as 80-90%, but within that transmission, you can have hospitalization and deaths. And that has been seen with funerals, that has been seen with choir services, that has been seen with lots of other events. So again, I think how do you find the fine balance between allowing events that celebrate or allow people to get together to grieve in a safe manner? At the moment, 30, possibly outdoors, maybe a bit more cautiously in a way that absolutely minimizes the risk of further transmission. There's no guarantees that there'll be no transmission, but what can you do to ensure that we minimize that risk? I think over the next 1 to 2 weeks, there may be some recommendations that may support that. But again, I think we have to remember that they should be, if allowed, those special occasions, and the caution around not really having a lot of social mixing in an ongoing fashion is still essential and important while we are in the pandemic.
I think with respect to graduations, that's an important conversation that parents and graduates can have with their school and the administration in their school, as well as their school division. And we'd hope that there is a way for many of the graduations to occur. I know in the constituency that I represent, there are some graduations that are moving ahead, albeit smaller communities. They are moving ahead with some very innovative platforms, and they're in-person graduations. So the schools and school divisions can most certainly work within the public health parameters that are there to hold some type of graduation on behalf of for the graduates that have worked so hard and quite frankly, I think are looking forward to some type of a celebration, celebrating the effort that they and the milestone that they have achieved.
The one comment I'll just make, I just received some messages from some people I know who were in health sciences who recently had virtual graduations. So even people who are graduating to work on the front lines of healthcare chose to graduate virtually. And what that shows is that even though you may be working at the front line with appropriate PPE, you still need to reduce, even as a healthcare provider, unnecessary social mixing as much as you can avoid. So I think those are decisions that we all need to think about. And while we all have important milestones in our lives that we want to celebrate and may be able to celebrate, we just need to curb our enthusiasm with some caution as well, and some, where we can, some processes that minimize risk of transmission. Because I know there's a lot of interest in graduations and sports teams. Even for sports teams, the guidance that is going to be developed is going to allow training within a certain group, the same group getting together to train, may allow some cohorting if there's play allowed between one or two teams within the same area. But travel throughout the province or nationally, multiple teams playing against each other, that's the kind of setting where we saw, major transmission events, which then went from one tournament to another. They were linked to one another, chains of transmission, provincially and nationally, as recently as March. And that is something we really can't see happening as we go forward as long as there's a pandemic. So again, some activities may be allowed, but how does the interaction among teams across geographical areas occurs? I think that's something that we all need to think very seriously about how do we minimize the chains of transmission at those types of events.
We'll take our next question from the phone line.
We have Kyle Benning with Global.
Hi, this question is for the Premier. Premier, we saw on Friday that the unemployment rate for May was at 12.5%. Now that pretty much every aspect of the economy is open, how confident are you that that number will drop and will drop into single digits?
I am confident that we are providing every opportunity for success when it comes to not only the economy but to our employment opportunities here in Saskatchewan. Listen, if we just back up to not that long ago when provinces across this nation were shutting down sectors of their economy, Saskatchewan was no different. We were looking at high risk in consultation with the Chief Medical Health Officer. We were looking at high risk points for interaction, and we needed to reduce the interaction of people, as his slides heard earlier shown. We did shut down a number of sectors of our economy, and it did have an impact on the employment numbers in Saskatchewan. I would say less of an impact than some other areas of the nation. In fact, I believe we had about a job loss of about 13% of all of the jobs in Saskatchewan, which means about 87% of the individuals were able to continue their employment here somewhere in a community in this province. That led the nation. I think the next closest was Alberta at 86% of their jobs remained. But then that being said, we have some work to do, and the first step in that work is to open up the sectors of the economy that have been not allowed to open for a period of time. That happens today. As I said, all but bingo halls, casinos, and theaters are open or have the opportunity to be open today. That's step one. Step two is for us to, as society, to increase our economic activity, to increase being out and about safely, but to ensure that that the businesses that are open are ultimately bringing in some revenue and being able to play and expand with the staff that they have. So, as you look ahead in Saskatchewan, I'm very bullish on where we can go here, just by the fact that as the world starts to recover, the products that we offer to the world, the mine products that we offer, the uranium fuel that we offer for clean nuclear power, the fertilizer in potash and other fertilizers that we offer to the world are very much needed in the months and years ahead. The energy products, some of the most sustainable energy products in the world come right here in Saskatchewan, and we're looking to access more of the world market with our energy products, despite the challenges that industry has had over the course of the last number of months. I'm very bullish on the future of Saskatchewan's energy industry, as it is one of the cleanest in the world. You put alongside that some of the manufacturing and value-added opportunities that we have. I'm very positive on what we can do in the months and years ahead, not only in regaining some lost ground with respect to our export numbers and our economic prowess, if you will, but getting back on track to achieving some of the targets that have been put out in our plan for growth and our vision for this province out to the year 2030.
Follow-up, Kyle?
Yeah, a lot of the jobs that are coming back have reduced hours, so forcing people to work part-time. Of course, if someone's working part-time, they're going to have less disposable income. So that being said, is there some concern there that with more jobs coming back but less money going into people's bank accounts, that the economy won't see the boost that maybe a lot of people are hoping for now that the restrictions are sort of being loosened?
Well, I think that is a step one, is to have that economy start to open, and I understand that there may be some reductions of hours from where they were pre-COVID in the initial days, but it's our hope that those hours will be resumed and resumed very quickly. Because of the industries that we have, like I had mentioned earlier, that are creating wealth in our communities, the export-based industries that are bringing dollars in from other areas of the world and spending those dollars, investing those dollars essentially into the other service-related industries, service-related sectors of our economy, that we need to improve, if you will, from some of the economic activity that will help some of the retail sector, most certainly in our communities. When you add to this is the reason behind our monumental investment in infrastructure, if you will, $2 billion. We've added to an already 2-year, $5.5 billion infrastructure plan. That is going to build schools and hospitals, as well as other pieces of infrastructure that will be very, very important in providing many of our sectors of our economy the opportunity to expand in the years and the decades ahead. So as you see that $2 billion of infrastructure commitment unroll over the next number of weeks and months, I think it will become evident that this is a government that is not only committed to reopening the sectors of the economy that had to be slowed during this COVID pandemic, but we are committed to ensuring that we can get back to where we were pre-COVID with respect to jobs, with respect to household family incomes, but we can very quickly get back on track to achieving the targets that we had put forward in our plan for growth, so that we can again be what we consider normal in growing our community's population, growing our opportunity, and really growing the opportunity for that next generation, our youth, this year's graduates, per se.
And we'll take our last question from the phone line.
We have Dan Jones with NBC.
Yeah, good afternoon, Premier. I noticed that you mentioned earlier that there were 6 active cases in the far north. I'm just wondering when Phase 3 will be activated in that region, and can you clarify the playgrounds and beaches will not be open in the far north at this point?
No, the playgrounds and beaches will be opening across the province this Friday. Phase 3, we'll have an announcement on Phase 3 in the northwest in sometime in the future here, but we're very pleased to be moving forward with 1 and 2 in the northwestern region, in particular in La Loche. And I think I'd take the opportunity to thank not only all of the individuals that were helping out with the outbreak that we had in La Loche and Beauval and some other communities in the northwest, but thank the community leaders, and most importantly, thank the individuals that, again, curbing the spread of the virus in those communities, it's just not an accident. It is a joint effort of so many taking their personal responsibility very seriously. They've done it, and for that I'm appreciative.
Follow up, Dan?
No, thank you.
Thanks very much for joining us today, everyone. That's all that time we have.